Good morning to my respected teacher and friends. Dear Mrs. Matriwati, as a lecturer in public speaking course, and your excellently to all my friends who attended this class. Ladies and gentlemen, we all know the 2019 coronavirus disease or COVID-19 pandemic is an ongoing problem in more than 200 countries around the world. Indonesia has been severely impacted by COVID-19 with the case fatality rate or CVR being 89% at the end of March 2020. Our country has some room for improvement regarding the eligibility of health faculties and major steps taken by the government. But what happens if the COVID-19 pandemic continues to escalate? What will happen if the rate of spread of COVID-19 increase instead of subsidies, even though all policies from the government have been implemented? What will happen if the vaccine that is found is still not effective in maintaining the immune system? And then what will happen to us if the previously mentioned things are not solved? What about our family and friends? And what actions should we take now? Isn't this something we have to think about now, right? Okay, let me start by telling you that this COVID-19 pandemic has become a global concern for people across the continent. It can affect many aspects in our life, my life, and your own life. As you can see and feel now, we have gone through many habit changes in life, such as continuing to ask masks. Who here are lazy to wear a mask? Now, what are we going to do with a mask? Luckily, we don't have to wear a mask to sleep. When leaving the house and when doing activities, there are also restrictions on activities outside, at home, at school, work, and so on. Doing learning via the internet or online learning, working at home or working from home. This situation was exacerbated by the situation of increasing spread in many countries, one of which was Indonesia. The limited space for discussion and direct socialization, and there were still many individuals who violated the regulations. Under these circumstances, what can we do to overcome this problem? Okay, today I'd like to focus on three things. Number one is the COVID-19 pandemic is in Indonesia. Number two is the impact of COVID-19 pandemic in Indonesia. And number three, the workable solution to escape with the impact. Okay, by 31 March on 2020, there have been 1,500 to 28 confirmed COVID-19 cases in Indonesia and 136 deaths related to the disease. The nation case fatality rate or CVR is also much higher than that of People's Republic of China. Indonesia's healthcare facility is not ready to face COVID-19 yet. Massive preparations should have been taken seriously at the beginning of disease spread in the People's Republic of China. According to the latest data of the Ministry of Health of Indonesia, there are only 309 hospital beds in Indonesia, with most of them being located on Java Island. On top of that, there are less than 6,000 intensive care unit or ICU beds nationwide. The number appear much, but in fact, Indonesia only had 27 ICU beds per 100,000 people, and thus the country ranked among the lowest in Asia. In addition, mechanical ventilator is not widely available in rural settings, and there is a of shortage of protective gear for healthcare workers. The things that became my focus in terms of what causes the COVID-19 in Indonesia to experience a high spike was the Indonesian people's non-compliance with the policies given. In my opinion, this is the cause of the increasing number of COVID-19 in Indonesia. Then also the unpreparedness of the Indonesian state with the presence of the virus, which made many changes and increased the level of people exposed to this virus. Okay, now let's talk about the impact of the COVID-19 in Indonesia. First, I will discuss the impact on us as a students, namely a very clear impact on the world of the education is that first we have to adapt to the current way of teaching that use technology. For example, if students in the past discussed directly in class, now students can discuss only using type message, voice message, or face-to-face through their technological device, such as cell phone, laptop, and so on. Strengthened by the emergence of various platforms for and teaching, online learning and teaching, such as Zoom, Google Meet, via WhatsApp video call, and so on. We have adapted to the current situation, even Turkey is very different. Another problem with the existence of this online learning system is access to online learning information that is constrained by signals that cause slow access information. Okay, so ladies and gentlemen, the COVID-19 pandemic is a situation where people are exposed to very high exposure to the spread of the virus. This situation also has an impact on all people from the old to the young. Those who play a role in the West work are not only that, it has an impact on education, which has changed more or less the education system in this country, such as online teaching as is it now. Therefore, the government must provide solution so that it can continue to work. Activities take place by preparing devices and applications that can be used. Of course, this has a good impact too, namely bringing up the innovation new tech that tech advantage the technological advance which can then be used anywhere, anytime, and with anyone. That's for the impact that appears in the world of education in Indonesia. That's all I can say. Hopefully, we can be grateful for everything that has happened. Hopefully, everything will get better. Let's take care of our health and follow the recommendation that have been set by the government. Unite for our country for progress. Let's take a step against the spread of this COVID-19 pandemics by daring to live healthy. Majulah Indonesia. Thank you.